welcome back guys. In this video we are going to talk about the diabetes and COPD, shock, stroke and sepsis. So let's start. We are going to see the quick revision things about these topics, and we will try to highlight the question part as well and what are the keywords in the question to understand some pathology. So let's start. So first of all, it is diabetes. What is diabetes? It's a chronic condition that affects how the body process the sugar levels. So type 1 is autoimmune. Type 2 is more commonly occurs when in the adults. Here are the ranges. In the type 1 patients, the risk is of diabetic ketoacidosis, and in type 2 patients, the risk is of HHS. Pre-diabetic stage, where the blood sugar levels are higher than the normal but not high enough to be classified as diabetes type 2. So what we are going to see as a symptoms in the patient. So in the patient, we will see thirst, urination, weight loss, blurred vision, slow healing sores, or frequent infections. So a lot of things can be there given in the question. Let's see the questions. You will understand well. 8-year-old child with the 3-year-old history of the diabetes was hospitalized to the hyperglycemic coma. Initial dose of insulin. So in order to treat the hyperglycemic coma, remember about the initial dose in the emergency cases, we start with 0.1 or 0 to 0.2 unit of the unit per kg of the body weight per hour. Next is the levels of normal levels of the sugar. So normal level are 3.9 to 5.5. After 5.5 will be pre-diabetes. 5.6 to 6.9 is the range of pre-diabetes, and after 7 will be diabetes. We are sure about diabetes once it is in the ranges of 7 millimole per liter. Maybe let's see first the diabetic ketoacidosis and HHS. So hyperhydration state. So in the cases of DKA, we will see glucose levels are more than 11.1. In the cases of HHS, we will see that glucose levels are more than 3.3. They are severely high levels. I have wrote the another units as well so that you remember or you don't find it hard in some other question. The pH we can see, although it's not mentioned in all the question, but the pH, as we see in DKA we see acidosis. In HSS we don't see any acidosis. Bicarbonate in DKA is less than 15 mmol per liter. In HSS are more than 15. So osmolarity is not elevated in DKA, and osmolarity is too much. It is the hyperosmolar hyperhydration state. So the osmolarity will be too much in the HHS state. Ketones can be present in DKA. However, ketones can be very minimal or absent in the cases of HHS. So let's get back to our question. So the question says a 23-year-old woman with diabetic mellitus type 1. So I have wrote in the cases that type 1 is autoimmune, and in type 1 patients are more prone to DK. Type 2 patients are more prone to HSS. She is having the history of type 1 of diabetes, and she got her glucose levels up to 28, or they are very high. So this is the case of diabetic ketoacidosis. You can read the case. I have a bit lesser time. I have classes all day today, so I'm getting late. So let's finish the topic faster. Also, I've talked about the urine acetones will be present. Urine acetones will be present in the DKA. We just saw the table. So they are asking about the correction method, like how you will correct this condition of the patient. Also the pH is given in the question. pH, which is metabolic acidosis, shows the case of DK very very well. So we are going to use the normal saline since the BP is very low. So in order to correct the BP of the patient, we'll use the infusion of normal saline, and we will give the insulin therapy in small portions. Plus we are going to correct the electrolyte balance. However, electrolyte balance will auto correct when we are using the normal saline. But remember, in the cases of diabetes, we have to monitor the potassium levels all the time, because some problem with the potassium levels can cause the more severity of the patient. Let's go to the next patient. Next patient is 35-year-old man who is has diabetes mellitus and chronic cholecystitis, and a lot of things are there. So 20 units in the morning, he's taking NPH and insulin. 20 units in the morning, 12 units in the evening, and after the meal developed pain in the right subcostal area, nausea, vomiting, sleepiness, increased polyuria. What pre-hospital measures will be most effective for the prevention of crisis with the next several hours? So the patient is not ready for this insulin regimen. The patient is not well with this regimen of the insulin, so change the insulin regimen. Simple. So next question says that there is a patient with the type 2 diabetes mellitus. So she is taking phyto preparation. So remember, when you have to correct the diabetes type 2 mellitus in the patient who is taking phyto preparation solidary, so instead of insulin, prefer metformin. All right. So HbA1, they are the long term management or long term glycemia, we say them. So normal is less than 5.7, pre-diabetic is 5.7 to 6.4, diabetic is 6.5 or higher, just to remember. Let's go next is a patient with the 38-year-old pregnant woman having diabetes mellitus type 2. So she is taking metformin already, but since she is taking metformin, but however we see that HbA1c levels are still higher than the norms. So it means the metformin is not good for her. So prescribe metformin, discontinue metformin and prescribe insulin. So discontinue the medicine which she is taking. Another question. You have seen the table. In one time itself you will remember the table. Let's see the next case also says about the a patient is taking manilin three times a day. However, her or his empty stomach glycemia is still 10 to 12 mm per mole, which is high. So it means the maninil is not working properly. So replace the maninil with insulin. Also the patient want to the examiner want to say that which will be the high efficient way to prevent the diabetic neuropathy. So best ways to prevent with the insulin. Replace the maninil with the insulin. So maninil stimulate beta cells to secrete insulin, but have limitations in the advanced stages of diabetes. So next question, the patient is unconscious and cause small respiration, skin is dry. So this is the case of diabetic ketoacidosis. We see acetone smell, or let's say a sweet smell, or signs of peritoneal irritation present. Sugar levels are 33. They are really high. So start with the short-acting insulin. Since probably the patient is having symptoms of positive peritoneal irritation, so probably the patient is going for the surgery right now, because it's the emergency surgery. As soon as possible we have to do that surgery. So we will prescribe short acting insulin to the patient in order to prevent any kind of complications. Next is shock. So shock is a life-threatening condition where the circulatory system fails to deliver sufficient oxygen and nutrients to meet the body's needs. So the signs we will see, signs of shock is tachycardia, tachypnea and hypotension. This is what you need to remember: tachycardia, tachypnea and hypotension. Just cram it somehow because you will need it everywhere. Tachycardia, tachypnea and hypotension. And the signs of increased intracranial pressure are just opposite to it. I have told you before. Let's see the types of shock. Hypovolemic shock, shock due to the blood loss. Cardiogenic shock due to any history of MI or heart failure. The distributive shock are of three types. So septic shock due to severe infection, anaphylactic shock due to some allergic reaction, neuroleptic shock due to some injury to the spinal cord or brain or to the CNS, or any trauma to or due to any special anesthesia. Obstructive shock due to any physical obstruction in the blood flow, because in some cases of pulmonary embolism. So next is right-sided heart failure shock. So the right ventricle, in this case, the right ventricle fails to pump the blood effectively to the lungs, causing the blood to back up in the veins. Symptoms will be peripheral edema, like the right heart failure symptoms, like peripheral edema, jugular vein distension, or ascites. These are the symptoms of right-sided heart failure or shock, right-sided heart shock. Let's see some questions. There are only two questions. Due to hemotransfusion, the patient developed nausea, tremor, lumbar pain, retrosternal pain, skin hyperemia. Later developed the pallor and present with the hyperhidrosis, which is excess sweating. Labored respiration, pulse is 110, BP is severely low to characterize as shock. Urine is black colored. So we got what we needed in the question. We got the tachycardia, pulse is 110, we got the tachypnea, labored respiration, and we got the hypotension. You can see the BP level in the patient. So it is the post transfusion shock because they did the hemotransfusion to the patient. So next, in the next question, this is the case of toxic shock syndrome. When the diastolic BP is 0, the patient condition is the severest as of severest. In this case is mark the toxic shock syndrome. Let's go next. Next is the case of COPD. COPD, let's get to the case directly. You all know what is COPD. 72-year-old patient having a lower extremity edema and sensation of heaviness in the right and subcostal area, dyspnea at the rest, over 25 years, suffering from COPD. So chronic obstructive pulmonary disorder. So orthopnea, jugular venous distension. Jugular venous distension I have just told you is the character of right heart failure. Diffuse cyanosis, acrocyanosis, barrel chest on percussion sharply. So let's get to the highlighted part. So weakened vascular respiration on both sides. So it means there is any obstruction or there is any fluid is there. Also the patient is having orthopnea. It means some fluid is over there. Moist crackles. I have told you in the pulmonary edema or a pulmonary embolism part that crackle is a character of edemata. Crackle is a character of fluid in the lungs, more like a pulmonary edema. And heart sounds are weakened. The second heart sounds is accentuated over the pulmonary artery, which states that there is an increased pressure. So liver is +3. What complication of COPD in the patient? So remember about the cor pulmonale, or let's say chronic pulmonary hurt. So the complication of COPD which occurred in the patient is cor pulmonale. Let's go to the next patient. Next patient is of stroke. So stroke occurs when the blood supply to the part of the brain is interrupted or reduced, and the brain cells begin to die within few minutes due to this thing. So there can be ischemic stroke, like the artery got blocked, the artery which supplies the brain got blocked. There can be hemorrhagic shock, like in the cases of severe bleeding due to any trauma. Sudden severe headache will be there, or TIA. We were talking at night in the last video about TIA in some questions. So TIA is mini stroke which occurs when the blood flow to the brain or any part is temporarily reduced, which will auto resolve most of the time. So symptoms of stroke you will see a fast stroke as a mnemonic you can remember. So let's see what is fast. So fast is face drooping, arm weakness, speech difficulty, time to call emergency service. Simple and sorted. Other symptoms which you can see can be neurological symptoms, because the patient is having low blood supply to the brain. So you are going to see the neuro symptoms, lack of coordination, like the sensory symptoms related to the CNS. Let's see the patient. The patient says a 70-year-old male patient having mild headache, speech disorder, weakness in the right limbs, element of the motor aphasia, central nerve paralysis of this and this, cranial nerve pairs on the right side. So the main thing which you can remember as a keyword for ischemic stroke is hemiparesis and hemihyperparesthesia. So KROK is going to use this word again and again in all the questions of ischemic stroke. So remember about hemiparesthesis is the weakness of one side of the brain, or hyperesthesia is abnormal increase in the sensitivity of stimuli to one side of the body. So this is the diagnosis you have made is ischemic stroke. So stroke, it means a clot got stuck in some artery which is supplying to the brain, right? So what you are going to prescribe? Anticoagulants. Let's go next. Next is sepsis. So sepsis is a reaction to an infection, which is immune mediated reaction to an infection, which will lead to the reaction will lead to the widespread inflammation. Immune system responds to an infection in a way that leads to the widespread inflammation. So some signs and symptoms you can see: fever, hypothermia, rapid heart rate, tachycardia, low BP, will be a septic shock after later stages. Urine output will be low. The person is clammy and sweaty, confused, disoriented. So sepsis is a life-threatening condition. So let's see some question over it. So there is a newborn having purulent discharges from the umbilical wound. Skin around the umbilicus is swollen. Child is pale, yellow, grayish in color. Hemorrhagic rash. Temperature is hectic in nature. So purulent discharges states what? States an infection. And when there is hemorrhagic rash, you can see the severity of the infection, that sharp fluctuation in the temperature. So skin around umbilicus got swollen. So a child is pale, yellowish. So the thing was just an infection, the purulent discharges. But the question in the question, the patient have this much of the things to mark as sepsis. However, they did not give me the BP of the patient. I used to remember the sepsis through an infection plus very low BP. So let's see the next question. A patient went for the lumbar phlegmon operation, having fever. The temperature rose up to 38. So after the phlegmon is a kind of infection, most common in the lumbar areas, and the temperature is 38. So after this operation we are talking about now, so got intoxication syndrome, increased leukocytosis in number, started to discharge pus, granulation in turned pale. So what complication had occurred? So phlegmon was an infection, and this has occurred, so it is sepsis. Next patient having also a surgically wound got clean. So on the 8th day after surgical wound was clean, he got pleuronecrotic content, granulomatous appeared, body temperatures got fluctuated, he got chill, excessive sweating, euphoria, tachycardia. So a lot of things are there. So complication of pyoinflammatory process, which complication has occurred? So complication is sepsis which has occurred. So next patient is having 2 and 3rd degree burn. So already assume that the burn patients are very prone to infection, because burn skin look like necrotized, so bacteria will get attracted to it. So on the 20th day after the trauma, the body temperature, general weakness, the BP. This is what I wait for the question of sepsis, like very severely low BP, diastolic BP. The complication developed after this and this is sepsis. So this is it with this video, guys. I hope your revision is getting well. Wait for the next video. Have a nice day.